Hello everyone. Today we will discuss about one of the very important anatomical landmark in cardiovascular system examination, that is the areas of examination like mitral area, tricuspid area, aortic area and pulmonary area, and the walls. So what is the relation in between both areas and the walls? Does those named areas lie exactly over the valvular region or not? That part we will discuss. So in this schematic diagram, to label the structures, this is left atrium. So left atrium, left ventricle, and we can consider mitral wall here. Then this is right atrium and right ventricle. So this is tricuspid wall, and this is superior vena cava, inferior vena cava, and as an outlet from right ventricle there is pulmonary vasculature. So this is pulmonary, and from the left ventricular outlet there is aorta, and at both of these great vessels we will get aortic wall and pulmonary wall. So these are the structures to label. Now first area, that is about mitral area, which is also called as apical area. So we know that apical impulse is outermost and downward most definite cardiac impulse, which is either felt or seen. So that is the definition. So if we go according to definition, when LV contracts, there will be closure of mitral wall. This is normal phenomena, right? So this closure of mitral wall will produce some waves. These waves will travel and they will hit the left ventricular wall. So once they hit here, we will be able to hear first heart sound, that is S1. So it is the cardiac impulse which is generating during the left ventricular systole. Meanwhile, there will be closure of mitral wall. So both of these events will lead to generation of some waves which will transmit and come and hit to the left ventricular wall. So that will generate the sound. So here we can consider it as apical area, also called as mitral area. So to observe here carefully, this mitral area is not lying exactly over the mitral wall. So this is the difference between area and the wall. Similarly, when it comes to tricuspid area and tricuspid wall, we know that this side, the first heart sound will be generated because of the, again, RV impulse generation, and during which tricuspid wall will close. So this will generate waves which will transmit and hit the right ventricular wall. So this part is called as tricuspid area. That is the area where these sounds are better heard. So we will consider that particular area for our examination. But as we can see here, this area is not overlying the exact wall. So here we can see again, here is the tricuspid walls, but tricuspid area is at this particular site. To consider the surface anatomy of tricuspid area, it is left lower parasternal area. Left lower parasternal area. Then coming to aortic wall and aortic area. We know that when LV contracts, walls will open. And one thing to remember is opening of any walls will not generate any sounds. Opening will be always silent unless there is some pathology. So when LV contracts, opening of aortic wall will not generate any sound. Whereas once the systole is completed, we know that there will be closure of aortic wall. So that there will not be any regurgitation of the blood. So once this wall closes, again it will generate waves, and these waves will be heard better over the wall of the aorta at a surface marking which we label as right second intercostal space. Right second intercostal space, which is also called as aortic area. So again we can see that aortic area is not exactly over the aortic wall. So this is the correlation. Similarly, when RV contracts, pulmonary walls will open and the blood will start flowing into the pulmonary vasculature. Again, once the systole is completed, to prevent the backflow, pulmonary wall will close. That closure will generate waves. They will transmit and hit the wall of the vasculature, leading to production of second heart sound. Here it is A2, here it was P2. So this sound is better heard at a surface marking of left second intercostal space, which is also called as pulmonary area. So as the other three areas, here also pulmonary area is not over the pulmonary walls exactly. So this is the correlation which we have to know when we are examining the cardiovascular system. So just to summarize, mitral wall and mitral area. So mitral area is mainly because of the closure of mitral wall, which will generate the wave, and it will be better heard in the apical area, that is downward and outermost definite cardiac impulse area. So that is called as mitral area. Similarly, tricuspid area is at left lower parasternal area, and not exactly over the tricuspid wall. Similarly, aortic is at right second intercostal space, and pulmonary area is at left second intercostal space. And again, those two areas will not exactly overlay pulmonary and aortic walls. So this is the anatomy and their importance during examination. Hope you got the point. And these basic understanding is very, very crucial during clinical examination. So my motto is to make you understand the basics very, very strong, so that you can tackle with any level of literature and any updates which will be coming in the future. Hope you are liking our content. Please share it among your medicos friends so that we can reach maximum number of audience. Also, please subscribe to our channel for more such academic videos. Thank you so much.